Welcome back. If your legs feel weak, tired, or swollen, it could be a sign that you have vein disease.
It is a very common problem, but many people ignore the symptoms and never seek treatment. Dr. Deborah Manjoney is here from the Wisconsin Vein Center and MediSpa to discuss venous disease and the in-office procedures now that they have to treat it, which is, we've come a long way.
We've come a long way.
Right? Good morning to you. I think a lot of people are interested and curious about your background. So it's been 17 years, right? That you've been doing the MediSpa and doing vein treatment.
Right. And before that, I was a cardiothoracic surgeon. And, you know, as a cardiothoracic surgeon, you're kind of on one end of the surgery spectrum, like that's where people go and there's nothing else that they can turn to. And yet, for something like this, it seems like a much more simple thing, but it is something that gives relief to so many people when we can treat their veins.
Did you see that there was a need and that's why you started in this
Yes,
business?
I really did. And I actually kind of backed into it a little bit, I will have to say, because I knew I wanted to start a medical spa. As a woman, I thought this is something that other women especially could appreciate. And I wanted to learn how to treat spider veins. And when I went to a course about spider veins, I happened to meet another thoracic surgeon who'd been taking care of varicose veins in his office for 10 years. And he said, but you've got to hear about this new laser method that's out there. And so I was one of the very early adopters. And I learned from one of the premier people who did it about these, what we call endovenous methods. In the past, first of all, veins were really not emphasized in medical school. No, but even today, I don't think the venous system is really emphasized as much as it should be, and the problems one can have with it, yet it affects millions of people in the country, in any Western civilized country. But we just kind of avoided varicose veins, and then when the treatment part came, as surgical residents, we hated it.
Because it was like stripping the veins, right?
It was invasive.
Messy and big incisions and lots of suturing up you had to do, and it was bloody, and the people were then in bed in the hospital for 2 weeks, and it was like, this is horrible.
Yeah, so that's the thing about the new treatments in office. And the recovery.
That's right. The recovery is almost immediate. People get up and walk out and do normal activities. And it's, you know, a very non-invasive or minimally invasive treatment. It's all done through needle punctures, just with a little local anesthetic. You know, you might be sore afterward, but you can still function. And it's just, you know, you're tender to the touch, that kind of thing.
It's like a night and day difference.
It is like a night and day
And
difference.
you can see.
So this is what, you know, we thread the little tiny laser fiber up inside the vein. And as we're withdrawing it, after we've numbed everything up, the laser is closing the vein on the inside. So it just seals it up, and it's immediate. They will notice the difference in how their legs feel within the couple of days, and then it's just from there recovery.
Well, I know you've always been interested in lasers and their application in medicine, but as you look at this before and after picture, obviously there's a huge cosmetic improvement.
That's exactly right.
But it's not just cosmetic.
No, actually, so many people have symptoms of vein disease, and that's another thing that doctors really didn't learn about or understand, just how it could be debilitating for so many people, especially mothers who are trying to keep up with their kids and want to be up and around. If they've had several pregnancies, that's made them much more likely to have varicose veins too.
So what are some of the symptoms that someone might...
Some of the symptoms would be leg fatigue, heaviness, leg swelling, itching of the skin where you have these veins, leg cramps at night. There are really a lot of different symptoms that could be symptomatic or emblematic of venous disease.
And it's more common for women to have it earlier than men.
Yes, it is, and to have the symptoms earlier too. Even if they don't have obvious varicose veins, if they have symptoms, often it's that great saphenous vein, what we call the trunk of superficial veins, that can be the culprit, and they don't even have varicose veins yet.
I was going to ask, so you don't even have to necessarily see that purple clump.
That's right.
Or that big vein going through.
Right.
And if you're experiencing some of these symptoms, you might have this.
That's right. And the other wonderful advance that has been made is that we now study these veins using ultrasound. So we can actually see which veins are working and which ones aren't. And back in the old days when I trained, that wasn't the case. You just would see something on the surface and you'd take care of it and you'd strip out the trunk vein and that would be it. Now we actually can diagnose which veins are working, which ones aren't, and really target our treatments appropriately.
Many vein diseases are covered by insurance.
They
too.
are. People who have symptoms from vein disease often have insurance coverage for these problems. And so, you know, there's no problem. Come in and get evaluated and see what's going on, because chances are, if you have venous disease, it's going to be covered even by your insurance plan. And if not, we have lots of ways to offer wonderfully discounted prices to people so they can get this problem taken care of.
Yeah, absolutely. It's great to come in.
Good
like you said, for the
information.
evaluation, the diagnosis has improved too so much. So here's a phone number to call for that consultation. It's 262-746-9088. The Wisconsin Vein Center and Medi Spa is located on Georgetown Drive in Pewaukee, and you can also visit them online at the address that you see there on your screen. Great to see you. Have a
Thank
great
you.
weekend.
You too.
Thank you.